myself, Dr. Dhiraj Prasad Jaishwal, अहिले चाहिँ म एज अ एसिस्टेन्ट प्रोफेसरको रूपमा चाहिँ डिपार्टमेन्ट अफ जेनरल फिजिक्स एन्ड इमर्जेन्सी मेडिसिनमा र एकाडेमिक हेल्थ साइन्सेसमा काम गरिरहेको छु र अहिले चाहिँ जेजिपम्यान र जेराजको एडिटोरियल एसिस्टेन्ट भएर पनि काम गरिरहेको छु म अहिले। मेरो यो प्रेजेन्टेसन कपिको डिक्लेरेसन चाहिँ आई हेभ नो एनी फाइनान्सियल बेनिफिट्स this presentation is a part of journal CME and it can be recorded and used for same by the journal and its members. So when talking about critical appraisal of scientific publications, we should have understanding about what critical thinking is. So I think we all are aware about this, that critical thinking is observation of any phenomenon and analyzing the process, their interpretation of data, and then draw conclusions from this, and we need to communicate or reproduce the results or the conclusions, and we use the conclusions to solve the problems which we face, for which we have consulted the publications. So with this basic knowledge in background, we will now proceed forward. So why we need critical analysis of the scientific publication? So we all know this is one of the most important skills a physician need to analyze any scientific literature critically to be updated in this era. Because this era is evidence-based medicine era. So selection, reading, and critical appraisal of publication is necessary to be updated in the era of evidence-based medicine. So the aim of this talk is to present the essential principles of the evaluation of scientific publications, and of course, for this we need to have basic concepts of the topic which we are analyzing. For example, if we are reading some articles on brain tumors or brain surgery, then we need to have a basic idea like what the brain tumor is or how the surgery is performed. So with this basic knowledge, we can proceed for analysis of the journal, the analysis of the article. So my hope from today's presentation is that this presentation will impart a clear understanding of the topic, like critical appraisal of the publication, to our new members especially, and help them to write of papers and help them make them interested to be a reviewer in our journal or other similar activities as well. So if we see the structure of scientific publication, basically most of the structure of scientific publication is like the title, the summary, and the keywords, which is the part of abstracts, and then followed by the main text. And the main text is divided into introduction, methods, results, and discussion, which we generally prefer as hindsight, and then end with the writing with appropriate conclusions and appropriate references. So talking about title and abstract, well structured, and it should be well structured and should reflect a good summary of the whole work. So, and of course it should be in journal style. So different journals have different their own guidelines to submit the different types of articles. So of course it should be in the journal style. So the title and abstract should indicate the study design with the commonly used terms in the title and the abstract, and it should provide an abstractive information and balanced summary of what was done and what was found in the write-up. So proceeding further, introduction familiarizes the reader with the subject matter of the investigation. So it should write with the current state of the knowledge, and it should be presented with reference to the recent literature. And the necessity of the study should be clearly written in the introduction portion, and the findings of the studies cited should be given in detail with quoting the numerical results, not only the descriptive portions or just quoting some other articles, but it should be enlightened in detail with the numerical supporting data as well. Inexact pages like inconsistent findings or somewhat better, somewhat superior, somewhat inferior terms to better should be avoided. And the text, the quoted text should give an impression that the author has read the articles cited, not just copied from other sources and uh, introducing it. And the introduction portion should progress from general to specific statements, and the introduction should clearly explain what the question of the study is intended to answer and why the chosen topic is appropriate in the of the setting of the context. So a well-written introduction should be short and precise. The aim of the objective should be mentioned. The rationale of the study should be mentioned, and the references monitored after each statement. And of course, different journals have different guidelines for like words. These much words have to be there. You cannot write more than that. So you should of course follow the journal's guidelines as well while writing the um, introduction. Regarding methods, methods is like a cookbook. So when going through this, it should the description of the method should produce a recipe so that the study can again be followed and repeated again and again. And there are no hard and fast rules, but the methods can be divided in many subsections. But basically, it should describe the stages of planning of the uh, research, the composition of the population, the composition of the study sample, um, the inclusion and exclusion criteria, the subject of interest versus control groups, and the execution of the study process, and of course the statistical methods, and whether the study is preceded by um, any before any preceded by any other study, small study or not. So was the investigation preceded by a pilot study or not? And are location and study period uh, are specified in the method section? Approval from appropriate ethical committee is very important because it is in when we do research in humans, so ethical consideration is very much important. So we should have a equal clearance from the concerned committee. The most important part of the study is its design. So what type of design is this, with how the sample size has been calculated, whether randomization has been done or not, which level of blinding is done, like blinding of only subjects means only the involved participants, or the staff who involved in the care of the patients, or the investigator itself, like which level of blinding has been done, how the data has been collected, how the measurements are done, what is the accuracy of the machines or equipments that has been used in the research purpose has to be clearly written, and statistical methods and analysis of the results have to be mentioned in the methodology portion. So while analyzing um, article, the methodology, when going through methodology, the following questions will come in our mind, and when going through the article, the article should fulfill the question. So if these questions are fulfilled, then we can assume that this is a good articles. Like, is the study design suited to fulfill the aim of the objectives? is it stated whether the study is confirmatory, exploratory, or descriptive in nature? What type of study was chosen, and does it permit the aim of the study to be addressed? Is the study endpoint precisely defined? What statistical measures is employed to characterize the endpoints? Are the geographical area, population, the study period, intervals between the investigations, follow-up are described in detail or not? So if these basic questions are fulfilled, then these should suffice for methodology section. So when going through results, the finding here should be presented clearly and objectively, without interpretation. What mistakes we usually do during this section is that we try to incorporate all the findings without seeing at objective. So the findings should be clear and it should be objective based. What objectives we have already fixed in the introduction section. And interpretation should be avoided in this section. It should include a comprehensive description of the study population. And after the general description, a second enlightened subsection should describe the relationship between different characteristics or estimates of the effect or risk factors. And tables and figures should be preferred in comparison to text. But what we usually do is like we also put the tables and then describe the tables as well. So this is not required during writing of results. And again, while choosing the tables should be of our objective base. Like what we do is like we uh, copy the whole table from the statistical softwares and then paste it in the result section. We don't know whether which variables are required, which variables are not required, which variables are required for our objectives, which variables will interpret our results or not. So this mishap should be known and should be avoided while writing the results. So, in discussion, the author should discuss his or results openly. It's like open viva to the author. So here, he or she can discuss the things he wants to say from his work. So again, this can be written in two parts, like comparison of the findings with the status means the comparison of the findings with the existing knowledge of the relevance, means similar study. And the second portion is the critical analysis of the study limitations or the critical analysis of the findings. So while going through the comparison of the findings with the status, we should try to answer the following questions. Like, does the study add the knowledge to the given topic, or it is just a file up to the existing files? So we should keep in mind that. And what conclusions can be drawn from the results? Will the findings lead the author, him or herself to consider or changes his her own professional behaviors? Like, is author him or herself modifying a treatment plan or taking previously unconsidered factors into account after having this workup or not? Do the findings suggest further investigations? These are any other investigations are required to support the findings of the work? Does the study raise new hitherto unanswered questions? Hitherto is like a journal term. It's like the questions that came during the discussions or during the planning of the write-up. So the answers of these questions are not answered during the initial phases, but as we go through, the answers come through. So if those answers have been answered or not, questions have been answered or not, and what are the implications of the results? So we find certain results, but if the results are applicable to the existing clinical scenario or not, we should keep in mind of that. And are the findings are in accordance with the major earlier studies? Because we have already we usually have cross-sectional or other studies, but usually the conclusions are drawn from the randomized control trials and meta-analysis. So our findings are in accordance with those findings or not? And do the results appear plausible? So are the results found are reasonable or not? So if the results are reasonable, or if the results or the factors we found in results are probable or reasonable, then these are good. So when and the second portion is critical analysis of the study's limitations. So where we should discuss the different factors that can be the backyard while interpreting the results, like possible sources of biasness, confoundings. Initially, we have certain numbers in the subject group, and then during the follow-up period, some has been mixed up. So, are the loss to follow-up has affected the results or not? Are there inter-group differences between the case and control samples? And are there positive selection of study? This usually happens in the clinical settings. Like we doctors usually try our research on the sick patients, but we don't bother about the normal patients. So that is the positive selection of the study population. So, are the results are based on the positive selection of the study population? So, if so, we should have a proper control to validate the study, validate the results. And are the results observational or experimental? So, this also have much effects because usually observational studies have not been supported by the analytical study, are not supported by the data. But in experimental study, we have data and significance values. So experimental studies, if done properly, have greater implications than the observational studies. And inappropriate study design and statistical tests. So this usually happens during the design of the study. So if studies are not properly designed or the statistical tests are not properly chosen, then that can misinterpret the findings. So we should be aware of that, and these factors should be considered while writing of the critical analysis of our limitations. So the more important, when we give more importance to the significant results and try to distort the existing scientific knowledge, which usually occurs in the clinical studies, as I have already discussed that in clinical settings what happens. So in those cases, there is high chances that the data, the results could not be generalized to the general populations. So, while writing the limitations, we should keep in mind these factors. So, in conclusion, this is the most important finding of our work, but it does not necessarily mean that the only positive findings should be noted. We should also mention the negative findings as well here. What we usually do is we try to write our positive findings in the conclusions or in the results or in the discuss the same things in the discussion section. So the positive findings gives us more publicability. So if we interpret the data as more positive findings, what our objectives have been set, so there are high chances that those articles get published. But this should not be done. We should also conclude the negative findings and the minor findings as well. And we should avoid conclusions neither supported by our study nor by other similar studies. And our own study results should be always given priority over the other investigation findings. It doesn't, we should not bother while writing conclusions whether our results are going to be implemented or not. this is the process of other process, whether our results are going to be implemented or not. This is the process of this is the other process. But we should include our negative findings, and if our findings are not significant, then also we should consider those in the conclusion sections. And also, while writing the conclusions, it should be short, 2 to 3 paragraphs, and it should not, again, include all the results and discussion. And it should be, the conclusion sections should be strictly objective guided. When talking about references, it should be always presented in the journal's styles, and we all know that there are different types of styles of writing the references. And the references must include all the sources cited in the text, tables, and the figures of the articles. And it should be up to date and should help the reader to explore the topics further. Suppose if we present a result, but the result came to be non-significant, but the reader wants to find what are the other similar articles, then the references should be done like that. When the readers want, then he or she should find the relevant topic of his or her interest. So, one of the most important section of any scientific publication is acknowledgement and conflict of interest. So, it is important section, and ethical sound articles must provide information on any sponsors of the study, any potential conflicts of interest, financial or otherwise. Any conflicts must be revealed in full in this section. So after going through all these sections of the article, after finishing, the critical questions that come in our mind and which should be answered after completing, after analyzing the article are, does the study pose any significant interesting questions or new questions in the questions in the floor or not? Are the statement and numerical data supported by the literature cited? Is the topic of the study medically relevant? Is the study innovative? Does the study investigate the predefined study goals or the objectives? Is the study design appropriate to address the aim and the hypothesis? Did practical difficulties lead to major compromises in study implementation compared with the study protocols, like there can be loss to follow up, or we cannot complete the process of write-up, or we cannot complete the whole trial, or cannot follow for the whole period. Was the number of missing values too large to permit the meaningful analysis? Again, this comes with the loss to follow-up, like we have certain samples and more than 50% or say some significant numbers has been dropped out, then of course this will affect the final results. So are there such missings or not? Was the number of cases too small, and thus the statistical power of the study are too low or could not be generalized? Was the course of the study poorly or inadequately monitored, like missing values or findings or like that? Do the data support the author's conclusion? Like our conclusion should also be supported by the findings of the study. And do the author and the sponsors of the study have any financial or other types of conflicts of interest? So if these questions are answered after reading article, scientific publication, then we should assume that this article is a scientifically written article. So there are different checklists to evaluate the scientific publication. One of these has been shown here. Like we have different questions on the sections, like in design section. Is the aim of the study is clearly described? yes, unclear or no. This is useful for usually for reviewers. When we are reviewing the articles, we need to go through these processes. Like, are the study populations and the inclusion and exclusion criteria described in detail, yes or no? Where the patients allocated randomly to the different arms of the study, yes or no? Is the number of the cases discussed? Where the sufficient cases involved or not? Are the methods of the measurements are standard or not? Is there information regarding lost data? Similarly, in the study implementation, are the treatment and control groups matched with regard to the measure relevant characteristics, like this is usually needed in case control study. Are the dropouts analyzed for difference between treatment and control groups or not? How many cases were observed over the whole study period? Are the side effects of adverse events during the study period were described or not? Similarly, while analyzing and evaluating the article, have the correct statistical parameters, parameters and methods have been selected, and are they clearly described? Are the statistical analysis clearly described? Are the important parameters included uh, in the analysis, or at least discussed? Is the presentation of the statistical parameters appropriate? Are the effect sizes and confidence interval stated for the principal findings? Is the apparent is it apparent why given study design or statistical methods is chosen, or are the conclusions supported by the study findings? So these are simple checklists there which we can judge the quality of the journals. Uh, so uh, these are all to discuss today while critically analyzing a journal or scientific publications. And my references are critical appraisal of scientific article or review article published in 2009, and stroke checklist, which is also a reference guideline for our journal. Uh, so, thank you.